Well, CBS News has learned that the man who opened fire near the Centers for Disease Control and Prevention headquarters in Atlanta on Friday fired at least 180 shots and broke about 150 windows. CDC staff worked remotely today after the shooting, and some staff members shared their accounts of the incident with CBS News medical contributor Dr. Céline Gounder today. And CBS News has agreed to conceal their identities.
Did any of you see this coming?
I wouldn't say we saw it coming. I would say more that it wasn't a surprise. And, CDC has been vulnerable for a really long time. I think it's shocking, but not surprising.
So we're hearing that Secretary Kennedy has just arrived in Atlanta at the CDC. Is there anything you would hope he would say to the staff of the CDC and for that matter, to the general public?
I think the challenge is that it would be hard for anyone to trust that he's sincere. He has been trashing, and the whole administration has been trashing the CDC and the work that we do, and they have fired people, and they have diminished the work, and they have discredited the work that CDC has done, not just with vaccines, but with many things. I don't think I want to hear him and pretend that I think that what he's saying is sincere, because I am sure it's not.
And CBS News medical contributor Dr. Céline Gounder joins us now. She is also editor-at-large for public health at KFF News. Céline, thanks for being with us. I'm listening to that interview right there and just thinking about how harrowing it was for those employees. Can you tell us a little bit more about what they said about that experience, and how are they feeling about how leadership has responded to this?
So all 4 of those employees that you saw there are women. 3 of them are moms. All 3 of the moms were dealing with being under fire, trying to get their kids from the daycare on campus, or there was a second daycare nearby the campus that they were trying to rush to. One of the moms was locked with a bunch of the kids in the classroom, actually in the bathroom of the classroom, to protect themselves for hours as they're waiting for the building to be cleared. And I think they're really disappointed in the lack of leadership. President Trump has yet to say anything about what happened. Secretary Kennedy, it took him until Saturday morning to say anything. And this was after he had posted photos of his fishing trip with his family on social media. Only after that does he say anything to the folks of the CDC and publicly. And Dr. Monterez, the new CDC director, she's not the one that organized the meeting of staff over the weekend. And it was not an all staff. It was by certain center directors who felt the need to do something. But there's been a clear lack of leadership at all levels since this happened.
I mean, when you hear 180 shots, though, I mean, that there certainly is a message and a feeling behind something like that. All this is happening against the backdrop of the CDC, as you well know, facing incredible, significant scrutiny by the Trump administration for its work. How do employees feel about that? And about this general medical misinformation in general, especially given the theory of why this accused shooter did this?
Well, they definitely feel like they're being scapegoated. We all went through the ringer during the pandemic, including the staff of the CDC. As I mentioned, all 4 of these staffers are women. 3 were moms. So I know, for a lot of families, the closed schools, et cetera, was really hard. But they lived through it, too. And I think people forget that these are true human beings who are making many of the same sacrifices themselves. I think that they believe that this has been unfair targeting of them by the administration since really January, as one of them was saying to me, and they have experienced waves of this with layoffs, funding cuts. A lot of the work that they have been doing being gutted. Now these attacks.
Well, I mean, we should point out, that authorities are looking into this possible theory that the accused gunman went to the CDC headquarters in part because he felt like the COVID-19 vaccine had made him ill. And that's the kind of misinformation that we're talking about here.
That's right. And disinformation, misinformation has real world consequences. You have the real world consequences of kids not getting vaccinated for measles and the outbreak in West Texas. And you have people attacking, harassing, assaulting people who have been working really hard in the public service. And yes, people make mistakes, but that does not justify somebody coming to shoot up a federal building and to hurt people.
No, certainly not. And Dr. Gounder, I also want to ask you about something else, turning now to President Trump's former Surgeon General Jerome Adams, who was critical of HHS Secretary Robert F. Kennedy Jr.'s decision to halt research on mRNA vaccines. I'm going to ask you about that. Let's take a listen first.
And this idea, again, helps us develop vaccines and new treatments for everything from cancer, melanoma, which my wife has, to HIV, to better flu vaccines and Zika. These are advances that are not going to happen now. People are going to die because we're cutting short funding for this technology.
What's your reaction to all this?
mRNA vaccines are one of the most important technologies when you're in a pandemic, because at least so far, there is no other vaccine technology that we can produce a vaccine for in an emergency like COVID. Let's say we have bird flu. In fact, one of the contracts that was canceled was for a bird flu vaccine. So, hopefully we don't find ourselves in that situation anytime soon. But it's not just for infectious diseases. It's also for cancers. We have amazingly promising data for melanoma, for example, for autoimmune disease. And so this is really a critical tool for many, many different conditions.
All right, Dr. Céline Gounder, thank you very much for being with us.